Disclaimer: We Level Up is not promoting the use of Subutex. This video explores dangers and consequences, not endorsement. Learn, don't use. Comment below. Stay safe. Welcome to the We Level Up Treatment Center video series. In today's video we will discuss: how long does Subutex stay in your system? A common medication for treating the opioid dependency is referred to as Subutex. It contains the active ingredient buprenorphine, which is a partial opioid agonist. This means it works by attaching itself to the same receptors in the brain that opioids like heroin and prescription painkillers bind to. This is how it achieves its therapeutic effect. You may have received methadone or Subutex prescription as part of your treatment plan if you or someone you know is seeking help for an opioid addiction. Both are essential components of medication-assisted therapy, a method for treating people who have an opioid dependency or addiction. When someone takes Subutex, the drug is absorbed into their bloodstream and metabolized in their liver. Subutex is used to treat opioid dependence. The metabolites are then expelled from the body through urination, defecation, and perspiration. The amount of time Subutex remains in a person's system is contingent upon several variables, including age, weight, metabolism, and liver function. How long does Subutex last? In general, the half-life of Subutex is around 24-42 hours, meaning it takes about 1 to 2 days for half of the drug to be eliminated from the body. However, it can take up to a week for all traces of Subutex to be removed. The drug can be detected in urine, blood, and hair for varying periods, with urine tests typically being the most common detection method. It is essential to be aware that Subutex can produce addictive and habit-forming effects, particularly when the medication is abused or taken in higher doses than recommended. Suppose you want to avoid becoming dependent on the drug Subutex. In that case, it is necessary to pay close attention to the directions provided by your physician and take the medication by those directions. In addition, if you are concerned about the length of time that Subutex may remain in your system, or if you have questions about the effects of the medication, it is in your best interest to speak with your healthcare provider. What is Subutex used for? Subutex is a medication approved for the treatment of opioid addiction. Like Suboxone, Subutex contains the active ingredient buprenorphine. It works by binding to the same opioid receptors in the brain that addictive opioids like heroin and prescription painkillers bind to, but with a much weaker effect. This can help reduce cravings and withdrawal symptoms in people with opioid addiction. Subutex, as part of medication-assisted treatment for opioid addiction, is effective in reducing opioid use, preventing overdose, and improving quality of life. However, like all opioid medications, Subutex has the potential for misuse, dependence, and addiction. When used as prescribed, Subutex is generally safe and well tolerated. However, when misused or taken in higher doses than prescribed, it can produce feelings of euphoria and lead to dependence and addiction. Subutex can also produce withdrawal symptoms if stopped suddenly, which can be uncomfortable and potentially dangerous. It's important to note that Subutex should only be used as part of a comprehensive treatment program for opioid addiction under the close supervision of a healthcare provider. This can include regular drug use monitoring, counseling, and other supportive services. If you or a loved one is struggling with opioid addiction, it's important to seek professional help. Treatment with medications like Subutex and counseling and support can help you achieve and maintain recovery. However, it's also important to recognize the potential risks and work closely with your healthcare provider to ensure the safe and effective use of the medication. Factors that influence how long Subutex stay in your system. How long does Subutex stay in your system? The time that Subutex remains in a person's system can vary based on several factors. Like Suboxone, Subutex takes several days to leave a person's system, usually around 9 days. However, some individuals can take more or less time based on different factors. Liver function is one factor that can impact how long Subutex stays in a person's system. Impaired liver function can lead to higher blood levels of Subutex and a longer Subutex half-life, which could lead to an increased amount of time for the drug to be eliminated from the body. Dosage is another factor that can impact how long Subutex stays in a person's system. Individuals who take larger doses of Subutex may take longer to eliminate the drug from their bodies than those who take smaller doses. The frequency of use is also significant in determining how long Subutex stays in a person's system. Individuals who use Subutex regularly or for an extended period may have a drug buildup in their bodies. As a result, it may take longer for the drug to be eliminated from their system than for someone who has only taken it once. Finally, co-ingestion with other drugs can impact the time it takes for Subutex to leave the body. Some drugs may make Subutex more concentrated in the body, which could lead to a more extended period for the drug to be eliminated. One example of such a medication is atazanavir, an HIV treatment included in medications such as Evodas and Rayataz. How long does Subutex withdrawal last? How long do Subutex withdrawals last? The length of time it takes to detox from Subutex can differ from person to person depending on several factors, including the amount of time an individual has been using the drug, the dosage they have been taking, and their own unique physiology. In most cases, the onset of withdrawal symptoms from Subutex can be anywhere from a few hours to a few days after the user's last dose, and the symptoms can last for as long as a few weeks. In most cases, the onset of withdrawal symptoms from Subutex can be anywhere from a few hours to a few days after the user's last dose, and the symptoms can last for as long as a few weeks. Restlessness, anxiety, profuse sweating, and muscle aches and pains are potential early symptoms of Subutex withdrawal. These symptoms may become more severe over the next few days, and they may be accompanied by new symptoms like nausea, vomiting, diarrhea, and cramping in the abdominal region. There is also a possibility that psychological symptoms, such as depression and insomnia, will be present. Subutex withdrawal symptoms typically reach their height between the third and fourth day after the user's last drug dose. At this stage, the person may experience intense cravings, severe anxiety, and sleep disruptions. Hallucinations, delusions, and other forms of psychosis are also possible for certain people with this condition. Several different factors can have an impact on the severity and length of withdrawal from Subutex. People who have used the drug for a longer period or at higher doses are more likely to experience more severe withdrawal symptoms that persist for a longer period. The withdrawal process may be made more difficult by co-occurring mental health conditions, such as depression or anxiety, which may necessitate additional treatment. Opioid addiction treatment. If you think a loved one is abusing drugs or alcohol, research the substances and their associated addiction to understand better what your loved one needs. Next, you must plan an intervention to provide your loved ones with options to battle the effects of drug addiction in a safe and supportive environment. During this intervention, offer compassion and support instead of judgment. Lastly, show your support throughout the entire treatment process. In addition, prolonged drug use can have severe physical and psychological effects on you, so seeking treatment as soon as possible is essential. To better understand how long hydrocodone stays in your system, getting medical assistance when needed is essential. Inpatient drug rehab offers intensive care that can help you promptly get through the early drug withdrawal stages. If you or a loved one is struggling with opioid addiction, call today to speak with one of our treatment specialists. Your call is private and confidential, and there is never any obligation. The We Level Up NJ Treatment Center network offers nationwide facilities. Connect with one of our rehab specialists. That's it for today. Please subscribe and hit the notification bell. Like, share and comment. We would love your feedback. Have a great day.